It's now time for Richard Roberson. He is the president and CEO of the Mississippi Hospital Association. Richard, always good to see you. Thanks for coming in.
Thank you. Good to see you as well.
So I ran into you not so long ago, and you were telling me you were headed up to D.C., that the AHA, right, had the convention up there?
That's
American
right.
Hospital Association?
American Hospital Association's annual meeting was up there. Really a very informative meeting. Had a great mix of Republican and Democrat legislators and political analysts and politicos. Great content, great conversation. I think the one thing that I can take away from that is nobody knows what the heck's going to actually happen. So
truer words have never been spoken there.
Spent many hours on a plane getting to and fro, and came back with about the same thing that I knew before I left, which is nobody's for sure how this is going to turn out.
Yeah, and I think that's what certainly in your industry, but really across the landscape of the country, everybody's kind of waiting to see. Mainly because we're trying to get this budget program worked out.
Right.
The structure of that's been talked about really since right after the president was elected. We knew this was coming, that finally, hopefully, there's going to be some effort to produce a budget through the 12 standard regular order appropriations bills. But the big thing that's so critical and so important, so pivotal in this particular round of negotiations is that the Trump tax cuts expire at the end of the year, which does have an impact on the healthcare industry. But perhaps the other big issue is the subsidized coverage and the subsidy structure of the exchanges, the ACA exchanges. There's that subsidy which was enhanced under the Biden administration, scheduled to expire also at the end of the year. That could have a huge impact on the whole country, including Mississippi.
Massive impact. We've got hundreds of thousands of Mississippians enrolled in those exchange plans. The enrollment has gone up dramatically over the last 5 years when those subsidies were put in place during COVID. It has helped a lot of people get insurance coverage.
Yeah.
And by default, it's helped hospitals get paid when people have that coverage. The scary thing is those, as you said, are set to expire at the end of the year. So what happens with that? We've heard potentially a staggered decrease so that folks at the higher end of the income spectrum would probably not keep the same level of subsidies in place. Folks on the lower end of the income spectrum may keep more of the full subsidy in place. We'll see how that shakes out.
Okay.
There's some uncertainty there. We don't want to see uncompensated care or uninsured go up in Mississippi and go back to where we were a few years ago, which is typically anywhere from 10 to 15% of our population was uninsured. So this has brought the uninsured numbers down, unfortunately, because in medicine the cost has gone up just like it has in all of our lives. Costs have gone up, so it costs more to cover fewer people than it did 5 years ago. So we haven't seen a significant drop in uncompensated care in terms of dollars, even though we've seen a pretty significant drop in the number of uninsureds.
Okay.
So it's been kind of it's that ebb and flow. It's just you're covering, more people, but it's more costly than it was 5 years ago. So the uninsureds have gone down, but the cost to provide care for them has still gone up. So it's a weird yo-yo effect on some of this stuff, and heck, I think hospitals, just like all of us, are waiting to see where it all lands and wait for it to hit the bottom, and then we'll see what goes on.
So as time has progressed, Richard, answer this for us. The commercial coverage sold in the exchanges, honestly didn't really have very robust networks.
That's right.
But that's improved somewhat here in Mississippi, has it not?
Yeah, I think well, first of all, over the last 10 years since the exchanges have been in place, we've had more exchange products come into Mississippi, more competition,
more carriers,
which has increased the carriers, has increased the network coverage, and that's been a positive thing. Mm-hmm. Yeah, for sure.
But and just so the folks will understand what we're really talking about there and what you're accustomed to, you go to the doctor, you receive medical services. If you're insured, you may have a copay you've got to cover, maybe a deductible you've got to cover. But in general, you put your card there on the counter, you expect the provider to bill the insurer, and then you just pay your part. But if they don't accept that insurance, they're not in their network, if you will, you still can get reimbursed, but you got to pay for it, then you got to file it, then you got to wait. And a lot of people just aren't in a position to do that.
That's right. That's right. That's exactly how it works. And, you know, and sometimes it can work out and it'll be fine and folks will get reimbursed by their carrier and go about their business. For other folks, just coming up with that initial upfront payment.
Yeah, you're out of pocket for a while.
Yeah. I mean, you might be upside down for a few weeks until your next paycheck.
Yeah.
And so that creates hardships. And so, you know, either you forego getting that medical care you need because you can't make that payment, and then your condition deteriorates, and then you're worse off than you were 2, 3, 4 months before when something perhaps was fairly minor gets worse. It's just, you know, it's like just like taking care of a house. If you leave your roof with a hole in it for too long, you're going to have more than just roof damage.
Yeah, the problem gets bigger as time goes on.
That's right.
So these are some of the dynamics, and then of course there's the giant Medicaid program. You and I were talking about that is now about $620 billion a year to the federal government. And of course the states have their respective match portions as well. But that's on the chopping block as our Congress is negotiating this budget package.
Yeah, I mean, you know, that's the scary thing is that when you start taking certain things off the table and say we're not going to cut this, we're not going to cut this, we're not going to cut this, it leaves some of the big ticket items is pretty much the only thing that's left to potentially cut. And right now, the biggest pot of money that's, I think, on the chopping block is Medicaid.
Yeah.
And, you know, and the president has said he doesn't want to cut Medicare, Medicaid, Social Security. That's what he said. And, you know, and then you've got the House right now having to look at some different options to cut Medicaid. Earlier this week, it sounds like Speaker Johnson took the expansion states a little bit off the hook is what it sounds like now, saying we're not going to cut the states that have expanded Medicaid. We aren't one of those states anyway, so that was kind of, you know, that wasn't part of our contemplation.
He said we're not going to change the 90% federal match.
That's right, change that match rate and cut that federal funding. So, okay, well then the next biggest thing that's out there is cutting the provider taxes, which has been a funding mechanism for years, the way states have raised money from taxing certain healthcare providers that help the state pay those healthcare providers. So it's, in our case, hospitals get taxed at the maximum amount under federal law right now, or just about at the maximum amount. And, you know, any cut in that has some major consequences for revenue coming into Mississippi that's being used right now to keep many of our hospitals afloat.
Yeah, so just to kind of clarify that for the folks is that providers, the healthcare institutions and physicians groups and so forth, everybody that accepts Medicaid essentially, they pay a tax to the state, which the state then uses to secure federal funding and operate its Medicaid program. California in particular has really, shall we say, leveraged that to a great extent.
Many states have, yeah.
And they have. And it's been scrutinized now, saying, wait a second, the state's nearly not picking up their portion alone, exclusively. They're actually taxing providers in the state to get more revenue, to tap more federal money. They're saying maybe we ought to ban that practice, in which case the federal government would be on the hook for less.
Yeah, that's right. And so, you know, so for example, in Mississippi, our state share compared to our federal share is roughly 77% is federal money, 23% state money. Well, the state has various options to raise that state share. They can raise it through general fund revenue. They can do special taxes. They can get it from insurance premiums, you know, whatever sources the state wants to apply. But one of those vehicles the federal government allows is for just a direct tax from a particular provider to go straight to the Division of Medicaid in our case and pay the state share through that. And right now, hospitals are paying roughly $450 million, which is right at that maximum amount that we can pay. Well, that helps draw down about $1.8 billion in federal funds and state funds when it's all matched. And I mean, that's a significant amount of money. So what we've estimated is if you were just reduce it from 6% ceiling to a 5% ceiling on that provider tax, the cumulative effect, state and federal dollars combined, could be about $300 million being taken out of the hospital programs.
I see.
Nursing homes are also another taxable group. They're paying that 6% tax as well. It's going to be, you know, $50 to $100 million out of the nursing home payments. And nursing homes are pretty dang important, too, in this equation.
And before we go to break here, I was just going to explain, and you can correct me on the other side of it if I say it's wrong, but they're willing to pay this tax essentially because that allows them to serve patients who do have insurance and they get reimbursed.
That's
Otherwise, they may be serving patients for no compensation,
Absolutely.
no reimbursement.
That's 100% right.
Okay,
Yeah.
just want to make sure.
That's right.
You
got it.
Yep, we got Richard Roberson, President, CEO of Mississippi Hospital Association. Taking a break, everyone. Richard Roberson, President, CEO of Mississippi Hospital Association. So what did you hear in Washington? I mean, what are they most concerned about, Richard?
Well, I think most of the concern right now tends to be around that provider tax reduction as it relates to Medicaid. Overall concerns beyond health care. The same thing that we read in the news every day. It's concerns about the impact of trade, trying to fix the trade deficit, trying to do something in the tariff space. Concerns about from some folks says it's a good thing, some folks say it's a bad thing. I think the dust is going to settle on that over the next few months, and we'll figure all that out. It sounds like there's already progress being made in some of those conversations.
Okay.
From the hospital perspective, we get impacted by the tariffs too, because even hospitals are importing medical supplies, equipment, needles, syringes, tubing, IV bags. Those things, many of those things are still made offshore.
Right.
And so, a 30% increase in the cost of those is going to have to be passed along somehow or borne by the purchaser. So, there's concern about that. But, look, we had some great meetings with our delegation. I can't say enough good things about the folks that we have up there representing Mississippi. They care, they're engaged, they're articulate about the issues, they are willing to sit down and have conversations that are meaningful, and those were great. So,
good.
Our delegation does a good job for us, and they've been supportive, for a long time. And they are concerned. They want to make sure that healthcare in Mississippi is where it needs to be. And, I feel good about the conversations that we had with our delegation up there. There's just still a lot of wait and see about what's going to happen. The Senate's waiting to see what the House is going to do. They got the first bite at the apple. Yeah. So I think the Senate is just waiting to see what the House comes up with, and I think the House is still a work in progress on what they're going to come up with. So.
Yeah. Well, the Speaker's got his hands full because of the large numbers, more than anything, and a lot of just dissension within the ranks.
Well, when the numbers are so razor thin, it is a tough lift to try to bring everybody on board, because that's essentially what it takes, is that unified body to come together and say, yep, all 218 of us are going in this same direction, and that's hard to do. But I don't envy them at all. What I made a point to talk about with some folks earlier this week was to say, the ACA kind of got muddled at the end with some complicated political things and some unexpected and untimely deaths that had happened. Senator Kennedy passed away, and it created some election issues in Massachusetts with Scott Brown. And so then the ACA, instead of being sent back through the process and fixing some things that were flawed in that bill, got pushed through. What I'm hopeful for is that we take some time, that we don't just rush this thing through, that we really examine potential consequences, try to best as we can avoid unintended negative consequences. And if we'll just take our time and be thoughtful and talk to each other about it, I think we'll end up with something that's sustainable. One of the problems for hospitals and everybody else is when these things keep flipping and flopping every 4 years, or every 2 years sometimes, when the Congress changes over, it's hard to fix a budget. It's hard to, as a business person, man, if I'm making budget decisions based off 2 years, that's a crazy ride. So that's just what makes it hard. And, we've talked a lot about just stabilizing hospital payments, stability language from the state legislature. Let's keep things the way they are now, for good, better, worse. Folks know what to expect and what they have to do to get paid. That's important. As you're trying to make a budget, as you're trying to hire a physician or a nurse or stand up a new program, let's at least know what I got to do to get paid, and not be changing that every year, every 2 years, or every 4 years. That's really the main thing. Our hospitals, I say it all the time, I've said it on your show, they're the lowest cost in the country. They do a great job holding down cost. A lot of that's out of necessity. When you don't have a whole lot of revenue to work with, you got to be smart about your money. And they do that, and they still provide excellent services, good quality services. We got to get off the floor of 50th in our chronic conditions that the hospitals try to work people through. But they're doing a good job, low cost, providing good quality. We just need some stability in the market.
Yeah. That's a great point. We are blessed in a small state and a poor state, which we are, really with second to none health care in our state.
Yeah, and look, I'll give a shout out to our nurses this week. This is National Nurses Week. Next week is National Hospitals Week.
Okay.
We've got nurses that are 24/7 standing there in our hospitals, in our clinics, across the state doing excellent work. They're passionate about what they do. They care deeply for their patients, and they want to make them well. Our hospitals, it's impossible for me to describe sufficiently the incredible work that they do every day.
Mm-hmm.
And there are really some trying times. We've worked closely with the Attorney General's office in the last few months, developing an awareness campaign about just how to treat people in the hospitals and violence against healthcare workers. We can't tolerate that. It's a stressful environment to work in. You not only endanger yourself, you're endangering other people when you act out in those settings. And so we're gonna have that coming out over the next few weeks with Attorney General Fitch, and she's been wonderful, and her staff have been wonderful to work with on that. So can't say enough great things about the things that are going on with our nurses as we recognize them this week, and our hospitals as we recognize them next week.
What are your members telling you, Richard, are their most critical challenges, and are they consistent with what you heard in Washington from around the country?
Yeah, it's the predictability of the payment system. It's what do we need to do tomorrow to get paid, and how does the ball move? Are we continuing to move the goalposts? Are we going to change the dynamics of the field? I mean, if you're on a football field and here's how many yards it is. That's great.
Yeah.
You can predict that. You can run plays off that. If, in the third quarter we decide we're going to change the layout of the field, and maybe for a first down you got to get 15 yards in the third quarter, and in the fourth quarter we're going back to 10 yards to get a first down. When those things change week to week, month to month, year to year, every administration, the flip-flop, we've got to have some stability, and it's crucial. And I say it all the time too. The one thing our hospitals and our medical care providers aren't going to ask. Now, when you fill out a form and you get admitted to a hospital, or you're coming in as a new patient in a clinic, you're going to reveal everything, maybe even the name of your dog gets on that form. I mean, there's a lot of stuff that goes into that. But the one box you're not going to check is if you're a Republican or a Democrat.
That's right.
They take care of that. And so we heavily depend on government payers in Mississippi. About 70% of our payments in hospitals come from Medicare, Medicare Advantage, Medicaid, or TRICARE.
Interesting. 70%.
So it is political. It's governmental, but it shouldn't be political.
I got you.
But that's the nature of the beast. That's where we are. Wish it was different, in many ways. I think we've got some great opportunities locally in our state and at the federal level to have real conversations about health care. And I think part of what we're seeing is a real conversation about health care. When you're looking to try to cut $880 billion, that's going to generate some conversation about what's important and what's not. And look, we're 100% in favor of going after fraud and abuse in the program. When I was with the Medicaid agency under Governor Barber, that's exactly what we did. We had the lowest payment error rate measurements in the country. We were around 3% on our PERM ratings. And we were real proud of that. We did a great job of making sure the payments that we were making were accurate and they were to the right providers and covering the right people. Can't say that in every state. Some are much higher. But we've done a good job in Mississippi through the years of trying to clean that up.
To what extent do the hospitals go, Richard, to try to just cooperate and identify these cases of fraud and abuse of the system? Because it happens on the provider side, that, and of course it happens on the subscriber enrollee side as well.
Yeah, providers are going to constantly have folks looking and reviewing their claims, reviewing and looking at their operations. You want that. I mean, you should be inviting that into your culture. You should be promoting awareness of what's the proper way to code and bill, and what's not. And so, you want to maintain great compliance programs, and our hospitals are all going to have those compliance programs in place. What we found a lot of times was that, there were some beneficiaries on the program, with Medicaid or any government program that shouldn't be on there. But there's ways to make sure that we do a better job of cleaning up the rolls. Someone passes away, they need to make sure they're coming off the rolls.
Okay.
If someone's not eligible, there's a way to check that. We've got lots of mechanisms now at our disposals electronically. You don't have to do everything by paper anymore.
Well, I was going to say that I've always felt that the way to combat this issue is by improving our technology and automation. We can't hire an army of people to go to verify all that stuff.
That's right. And the legislature, I think it was around 2017, 2018, I think Chris Brown was chairman of Medicaid at the time, and we put in place, I think it was called the Restore Hope Act, which increased the verification systems for making sure that people that were on the program were the ones who were eligible for it.
Okay. That's the way it should be.
Yeah, absolutely. Common sense stuff.
Richard, appreciate you coming in, man. Enjoyed the conversation.
Always good to see you, Gerard.
You got it. Richard Roberson, President, CEO of Mississippi Hospital Association, has been our guest. We're stepping aside for a break, coming right back with the final half hour of middays for this week. Stay